Did you know that simply being in menopause, your liver is affected? Your liver can be affected if you don't take HRT, and your liver can be affected if you do take HRT, depending on the kinds of therapy you're using. Welcome to the second video in this series, where I'll help you navigate and make choices that support your liver function during menopause. During menopause, the liver can become compromised due to several factors associated with hormonal changes, lifestyle, and health conditions that are more prevalent during this stage of life. In my last video, I mentioned how hormonal changes are just one way that the liver can become compromised. Estrogen decline. The reduction in estrogen levels during menopause can impact liver function. Estrogen plays a role in regulating the liver's ability to process and metabolize fats and cholesterol. Lower estrogen levels can lead to an increase in fat accumulation in the liver, contributing to non-alcoholic fatty liver disease, or NAFLD. Second, hormone replacement therapy, or HRT. Some women use HRT to manage menopausal symptoms. While HRT can be beneficial for keeping non-alcoholic fatty liver disease at bay, it can also affect liver function, particularly if the therapy involves oral estrogen, which passes through the liver and can impact its workload. I'll talk more about which type of HRT poses the least risk. So, let me start by looking at the benefits and risks of HRT and the liver. Hormone replacement therapy, or HRT, can potentially help with fat accumulation in the liver due to low estrogen levels. As I mentioned earlier, estrogen plays a crucial role in liver health. First, fat metabolism. Estrogen helps regulate the metabolism of fats in the liver. When estrogen levels decline during menopause, there can be an increase in fat accumulation in the liver, leading to conditions such as the non-alcoholic fatty liver disease, or NAFLD. Number two, insulin sensitivity. Estrogen plays a role in maintaining insulin sensitivity. Lower estrogen levels can contribute to insulin resistance, which is a risk factor for NAFLD. How HRT may help. First, reduction of fat accumulation. HRT can help restore more normal fat metabolism processes in the liver, potentially reducing fat accumulation. Reduction in visceral fat. HRT has been shown to reduce visceral fat, which is closely associated with liver fat. Number two, improved insulin sensitivity. Lowering insulin resistance. Estrogen replacement can improve insulin sensitivity, thereby reducing the risk of fatty liver disease related to insulin resistance. Number three, anti-inflammatory effects. Reducing liver inflammation. Estrogen has anti-inflammatory properties that can help reduce inflammation in the liver, which is beneficial in preventing the progression of fatty liver disease. Several studies have indicated that HRT can lead to reductions in liver fat content and improvements in liver enzyme levels in postmenopausal women. Observational data suggests that postmenopausal women using HRT have a lower incidence of NAFLD compared to those not using HRT. Choosing the right form of HRT. First, transdermal HRT, a patch, gel, or cream, is often preferred for its safety profile, particularly concerning the risk of blood clots and liver stress. It bypasses the liver in this form and provides a steady release of hormones. Number two, oral HRT. While effective, oral HRT passes through the liver and can have a higher risk of impacting liver enzymes and overall liver function. However, it still may be beneficial for some women depending on their individual health profiles. Considerations and risks. First, individual risk assessment. It's crucial to have a thorough assessment by a healthcare provider to determine if HRT is suitable, considering personal and family history, especially concerning liver health. Number 2, monitoring. Regular monitoring of liver function and overall health is essential while you're on HRT to ensure its benefits outweigh any potential risks. Number 3, lifestyle modifications. Alongside HRT, adopting a healthy lifestyle is vital. This includes a balanced diet, regular physical exercises, avoiding excess alcohol consumption, and maintaining a healthy weight. HRT can help mitigate fat accumulation in the liver, as I've mentioned, associated with low estrogen levels during menopause by improving fat metabolism, reducing insulin resistance, and by lowering inflammation. However, the decision to use HRT should be made with careful consideration and under the guidance of a healthcare provider with regular monitoring to ensure safety and effectiveness. A fatty liver significantly impairs the liver's ability to process toxins due to reduced liver cell function, increased oxidative stress, disrupted metabolism, and impaired bile production. Consequences of impaired detoxification. First, accumulation of toxins. Inefficient detoxification leads to the buildup of harmful substances in the body, which can affect overall health. Secondly, increased risk of systemic issues. Accumulated toxins can contribute to systemic inflammation, oxidative stress, and the development of chronic diseases such as cardiovascular disease, diabetes, and kidney disease. Number 3, worsening liver damage. The inability to process and eliminate toxins effectively can create a vicious cycle, further damaging the liver and exacerbating NAFLD. So, how can we support the liver and other key detox systems during menopause? To support the key detox systems and liver health during menopause, it's important to consider the following, which most of you would probably already know and are doing, or at least attempting if you're striving to live healthy. First, a healthy diet. Focus on a balanced diet rich in fruits, vegetables, lean proteins, and healthy fats. Limit the intake of saturated fats, refined sugars, and processed foods. Number 2, regular exercise. Engage in regular physical activity to maintain a healthy weight and improve metabolic health. Number 3, moderate alcohol consumption or no alcohol consumption. Limit your intake or stop completely to reduce liver stress. Number 4, hydration. Drink plenty of water to support liver function and overall health. Number 5, medication management. Use medications judiciously and under the guidance of a healthcare provider to avoid unnecessary liver stress. Take HRT to replenish estrogen and to prevent NAFLD. Number 6, regular health checkups. Monitor your liver function and overall health regularly with your healthcare provider, as I've mentioned. Number 7, stress management. Practice stress-reducing activities such as yoga, meditation, and deep breathing exercises to reduce your overall body stress, including liver stress. By addressing these factors, you can help protect your liver during menopause and maintain overall health and well-being. How is the thyroid affected in menopause? Understanding the thyroid and menopause. This small butterfly-shaped gland in your neck plays a crucial role in regulating metabolism, energy generation, and overall hormonal balance. During menopause, changes in hormone levels can stress the thyroid. Some women may experience symptoms of hypothyroidism, which can manifest as fatigue, weight gain, and mood swings. There's a higher prevalence of hypothyroidism in women, particularly during and after menopause. And these symptoms of hypothyroidism can also be symptoms a woman experiences when transitioning to menopause, as I've mentioned in other videos, as her hormones are in flux and eventually declining across the board. The impact of toxins. Our environment has changed dramatically with a significant increase in chemical pollutants that affect our health. These chemicals can disrupt the delicate balance of hormones, including your thyroid hormones, which makes it crucial to detoxify, along with the universal support points I've already mentioned in this video. It's important to hone in on the thyroid with this 4-step protocol. First, dietary adjustments for your thyroid health. The first step would be removing trigger foods. Eliminate foods that commonly stress the thyroid, such as gluten, soy, and dairy. These can inflame the body and impair your thyroid function. Step 2, adding supportive foods. Incorporate foods rich in selenium, zinc, and iodine, like seafood, nuts, and seeds, which are vital for your thyroid health. Also, focus on high fiber foods to aid digestion and toxin removal. Step 3, reduce toxic exposure. And step 4, supporting the detox pathways. Enhance liver function by consuming liver supportive foods like garlic, beets, and leafy greens. And consider supplements like milk thistle and dandelion. The other detox pathways include, as I mentioned, the liver, which is the central organ for metabolism and transforming toxins, the kidneys that filter and excrete waste products through urine, your lymphatic system, which transports and filters waste products from tissues, the skin, which excretes toxins through sweat and sebum. You can facilitate toxin release through the skin via regular sweating, through exercise or sauna use, and ensure proper skin care to keep pores clear and functional. Lungs expel volatile toxins through respiration. The digestive system eliminates waste products through your feces. So you can maintain a healthy colon by staying hydrated, eating a high fiber diet, and using probiotics to support gut health. These systems work together to ensure that toxins are efficiently removed from the body, maintaining overall health and preventing the accumulation of harmful substances. There are advanced detox techniques. While these types of interventions might be helpful, they can make you feel worse, especially if you have a thyroid disorder in menopause. And this is because they can pull toxins out from storage within the body at a more aggressive rate, which can be overwhelming to the detox pathways that are already overburdened. So please be gentle and start with steps 1 to 4 to protect your thyroid. People today have higher toxic loads than ever before, combined with a reduced ability to handle the toxins. A more forceful detox method can overwhelm the detox system with more toxins, as I've mentioned, than it can clear, resulting in toxins circulating in the bloodstream and depositing it in other parts of the body, which might result in an autoimmune response in a new organ like the brain or the pancreas or your liver, or even a dramatic increase in thyroid antibodies. Let me just give you an example. Even abruptly using algae such as spirulina or chlorella in your diet, even though these are natural chelating agents, one can experience rashes, weakness, and a new autoimmune reaction. The algae bind to heavy metals and other pollutants, and then they are removed through the digestive tract, aiding in detoxification. So once again, start slow. Already having the healthy precepts with the 4-step detox in place before trying chelation. Most people with thyroid disease also have altered adrenal hormone activity. As we know from my last video, the adrenal hormones are our stress hormones that tame our inflammation. Mobilized toxins produce inflammation, and when left unchecked, this can lead to fatigue, pain, and headaches. Impaired gut function is usually seen in those who have thyroid issues and means that there is a reduction in absorption of nutrients required for detoxification and reduced excretion of toxins that we really want to get out. And this is especially true with constipation, which holds toxins in the body. I'm going to end this video here and explore the toxins that we are exposed to that trigger these diseases in my next video, along with a practical protocol. Please share this video, like and subscribe to my channel. I look forward to seeing you next time.